The title of the article that I'm referencing to my behavior change project and learning activity 3 is Differential Reinforcement of Alternative Behavior in Center-Based Classrooms, Evaluation of Pre-Teaching the Alternative Behavior. Authors include Legray, Dufresne, Mercer, Olmi, and Sterling. Research question. This study investigated the effectiveness of a differential reinforcement of alternative behavior procedure in decreasing disruptive behavior while simultaneously increasing the appropriate behavior of 4 children of typical development between the ages of 4 and 6 in center-based classrooms. Dependent variable. Appropriate vocalizations and inappropriate vocalizations. Appropriate vocalizations were defined as any task-relevant vocalization emitted by the child. Example, responding to a teacher's question, producing sounds in response to early literacy instructional prompts. Inappropriate vocalizations were defined as any task-irrelevant vocalization or verbal noise made by the child, including humming, making unusual vocal noises, clicking sounds, speaking to other children when not required to do so, or swearing. Interrogator agreement IOA was evaluated for 42.8% of the functional analysis sessions and 47.1% of the intervention sessions. IOA was calculated as the total number of agreements, occurrence and non-occurrence, divided by the total number of agreements plus disagreements and multiplied by 100%. School psychology graduate students were trained to conduct observations, and 90% agreement with the primary investigator was used as a criterion for observers. If an observer's average agreement fell below 90%, then they were retrained on observation procedures until they again met the 90% criterion. Treatment fidelity. Treatment integrity data was collected for 100% of the intervention sessions. Results. The primary purpose of the study was to expand the literature on functional assessment and function-based interventions for individuals of typical development in traditional education settings by examining the extent to which pre-teaching the alternative behavior enhances the effects of DRA. With regard to the functional assessment literature, this study extends the knowledge base by providing an additional replication of the usefulness of functional assessment in center-based education settings with children who do not have developmental or intellectual disabilities. Functional assessments research in center-based classrooms with children of typical development is relatively limited. Results of this study are consistent with previous research that has demonstrated the utility of functional assessment procedures for identifying relevant contextual variables that can be adjusted to create effective interventions in center-based classrooms during typical instructional activities. In addition, these results, in combination with the results of prior studies, demonstrate the usefulness of functional assessment in the development of function-based intervention strategies for young children engaging in the common disruptive classroom behavior. Results from the study demonstrated that pre-teaching the alternative behavior immediately prior to the DRA sessions resulted in a greater display of the alternative behavior and reductions in the problem behavior relative to the DRA alone. Conclusions. There are at least 3 possible explanations for these findings. First, young children may need to pre-teaching of the alternative behavior because of a relatively limited response repertoire. It may be that young children's relatively limited learning history decreases the probability that they spontaneously emit desired alternative behaviors in response to the extension component of DRA. As a result, pre-teaching may increase skill development for the alternative response. Second, the PT plus DRA condition included a distinct discriminative stimulus for the reinforcer, whereas the DRA alone condition did not. As a result, the PT and DRA procedure may have been more easily discriminated from the DRA alone condition because the contingency in the PT plus DRA condition was specified. Finally, the DRA alone condition included a relatively thin schedule of reinforcement, which when combined with the lack of a salient, discriminative stimulus may have resulted in diminished effectiveness relative to the DRA plus PT condition, which had an identical schedule of reinforcement but more salient discriminative stimulus. While this study provides data for only 4 participants, results are clear in that pre-teaching the alternative behavior was a beneficial addition to DRA. Practitioners might consider these results when developing function-based DRA interventions. The limitations include, first, for brief functional analysis, the contingency reversal included a DRO procedure, whereas other brief functional analysis studies included DRA during the contingency reversal. Inclusion of DRO may have resulted in a more rapid suppression of inappropriate vocalizations due to the reinforcement of the omission of responding as well as extinction. The suppressive effect could have impacted responding in the subsequent contingency reversal and intervention sessions. Second, the study evaluated the effects of pre-teaching with 4 preschool children who displayed inappropriate vocalizations during academic instruction. What is unknown is whether results from the study were generalized to different populations and topographies of behavior. Therefore, for future research should include evaluation of PT plus DRA with individuals at varying levels of functioning in a variety of settings and presenting with diverse behavioral concerns. Thank you.